Good afternoon. We are going to talk today about stress and cancer with Dr. Abrams in our latest version of Afternoon Chat with Dr. Abrams. So, the cancer diagnosis is a tough one, both physically and mentally. Let's start with Dr. Abrams' experience. Roughly what percentage of your patients show signs of stress after a cancer diagnosis when they come to see you?
I think stress is really something, as you say, that getting told you have cancer is difficult to avoid. I don't think stress in and of itself can cause cancer, but stress is not good for cancer or anything else. Stress is adrenaline or epinephrine, which kills your lymphocytes, the building block cell of the immune system, which help fight off cancer. And stress is cortisol, a steroid hormone, which is an immune suppressant. I think stress interferes with sleep, and we believe that sleep is very important. And so, if stress is interfering with sleep, then that's not a good thing. Stress also impacts your relationship with your family and friends, and that support is very necessary. Sometimes, if you're too stressed out and too anxious, people are going to sort of withdraw and you're going to lose a support group. So in addition to the physiologic, effect on the immune system, the effect on sleep, the effect on relationships, I think is also something that we need to be concerned about. The percentage of patients, I'll tell you, probably varies. Newly diagnosed patients are very stressed because they're dealing with the unknown and they think they have a terminal event facing them. Survivors are a different story. I often, in my group visits, ask survivors in my last session to rank their stress on a 0 to 10 scale, and so many give it a 2. And in asking how that happens, they say, well, I've had cancer and I've been treated and I've been through all that, puts everything else in a different perspective.
Okay. So newly diagnosed show a high level of stress response, but once you're on the other side of it, you really have a different perspective around what stress means.
People do. I think people that have a sort of more of a chronic cancer, like men with prostate cancer, women with low-grade breast cancer, those cancers that are, commonly can come back, live in a state of constant anxiety, fear, stress, because it might come back. And those are the people I really work with to try to decrease stress, because, it can become a self-fulfilling prophecy if that stress is going to impair the immune system so it can't fight off impending cancer.
So what therapies do you recommend to your patients in an effort to manage their stress?
Physical activity is something that frequently is brought up as very useful for decreasing stress. When you're physically active, we know that you release endogenous opiates and endogenous cannabinoids. And that's what gives the runner's high, which is decreasing stress. So the number of people who like physical activity is big. And physical activity for me that's useful for decreasing stress and anxiety is yoga. I was sort of late in life discovering yoga, but I find that yoga is about strength, flexibility, and balance, but it's also a mind-body intervention that allows you to sort of dissociate your mind from your body and move with your breath. So physical activity, including yoga, acupuncture. Many patients tell me that their benefit from acupuncture is really being relaxed. Massage, some of the energy medicine interventions, Reiki, Jinshin-jitsu, those are also good for decreasing stress as well. If you want to get control of your mind, the breath is really the link between the mind and the body, because right now we're breathing without thinking about it, that we can control the depth and the rate of our breath. And that's sort of yoga, meditation, hypnosis. Those are all based on breathing. So just learning some breath work is something that I recommend for people as well. As far as supplements, magnesium, interestingly, is felt to be calming. And I personally have started taking some magnesium at night before I go to sleep because it's supposedly calming. With regards to the botanicals, I think chamomile and lavender jump to mind as being useful for decreasing stress. Also, valerian, lemon balm, and hops are good for stress reduction. I actually have a sleep formula that includes all 6 of those plus a little melatonin. And again, those are all good for reducing stress. Passion flower is another botanical that's also useful for stress. And then for me, the big one that people use a lot here in San Francisco is cannabis. Mm-hmm. Cannabis does seem to have ability to decrease stress, help people with sleep. I'm a believer in the whole plant and not taking isolated cannabinoids, but CBD has been studied in people with social anxiety. And if you gave them a simulated public speaking appearance, people that got 600 milligrams of CBD were less anxious than people who got placebo. Well, 600 milligrams of CBD is a pretty big dose compared to what people are taking out in the community. So I don't know if it's CBD itself, or I would go with cannabis for the stress reliever.
What are the risks of some of these therapies?
I don't think that many of these therapies are particularly harmful. I mean, physical activity, certainly you have to be, cautious and not overdo it, depending on your age and fitness. Acupuncture, really not. The botanicals that I mentioned are generally very well tolerated with not many adverse side effects. I think cannabis probably is the one that we would be most concerned about. Dizziness, lowering the blood pressure, or increasing the blood pressure and increasing the pulse. I would caution elderly people, especially people with heart issues, to be cautious if they're going to use cannabis or a cannabis-based medicine. But in general, these things I think are very well tolerated.
One final question. These modalities that we discussed, are they of value not just to the patient, but caregivers as well?
Oh, sure. Yeah. None of these are specific for people living with or beyond cancer. They're general recommendations for stress reduction.
Thank you very much. We look forward to talking to you in our next session. Bye-bye.